Hello, welcome to Period Stories. My name is Dr. Janice Krystal Ascencio, and today we talk about sexually transmitted infections. We're going to break it up today to speak about those which are bacteria, and the ones that we're going to focus on today are chlamydia, gonorrhea, and syphilis. Let's jump in. So, what is a sexually transmitted infection? This is an infection passed from one person to another through sexual contact. This sexual contact could be through oral contact with the genitals, could be contact with the anus, or contact with the vagina. All these are ways to pass an infection. There are three main categories of sexually transmitted infections. There is bacterial, and those that we're going to talk about today are chlamydia, gonorrhea, syphilis. There's also viral, those which are virally transmitted. Those are human papillomavirus, human immunodeficiency virus, herpes, hepatitis B, and then we have the more parasitic, which include pubic lice or trichomonas. As I said before, we're going to focus in on bacterial infections, and those are curable, whereas some, including the viral, may be for a lifetime. So let's talk about chlamydia. Now, chlamydia is also called the clam, and done so because of the creamy way the discharge appears, almost like clam sauce. I hope I'm not turning you off from eating clam again. But this is usually a silent infection. But if you do have symptoms, it may include pain or burning with urination. You may have lower abdominal pain, sometimes unusual vaginal bleeding, unusual white or pus-colored discharge, unpleasant smell, fever, or pelvic inflammatory disease. And as a result of that, you may have chronic pelvic pain. As you can see on the imagery here, this is showing you the cervix. So when we put a speculum into the vagina to look and examine a woman, the end point of the vagina, we see the cervix. And so this is showing the cervix. This is showing the discharge. You can see it's a little bit more red here on the surface of the cervix. This image here is to show you sort of what a healthy cervix should look like. And this is just showing you what a cervix infected with chlamydia looks like. So why do we care if a person gets an infection with chlamydia? Well, chlamydia can infect the eyes, the throat, the lungs, the lymph nodes, the rectum. There can be permanent damage to the reproductive system, which can make it difficult to get pregnant later on. A woman with a history of chlamydia infection may be at a higher risk for ectopic pregnancy. Let's jump in and see why that might be so. All right, so in terms of quick review, when you ovulate or the egg pops out of the ovary, that egg is taken up into the fallopian tube. So we're right about here. And then, through sexual intercourse, sperm is deposited here in the vagina. It swims up, it would meet that egg, fertilize that egg, and then the point is for the fertilized egg then, as it goes through its changes, to migrate all the way up until it finds a nice cushy spot in the uterus to implant. Now, what happens when you have an infection in the fallopian tube or an infection that has gotten to damage the fallopian tube is that the path is interrupted. And so that fertilized egg may not make its way all the way back into the uterus to be deposited, but it gets stuck here in the fallopian tube. And that is usually the placement of an ectopic pregnancy. Now, ectopic pregnancy just means a pregnancy is in a spot where it shouldn't be. But we're talking about a specifically tubal ectopic pregnancies, those that are happening, those pregnancies that occur in the fallopian tube. Again, a pregnancy should be in the uterus. It should be in here, implanting here. Let's look at the other things we talked about, that we can have infection in the eye. We can have chlamydial infection in the lungs. Can cause you infection in your throat. It can cause you infection in your lymph nodes, as well as in the cervix and rising up. And that can be, you can also have pelvic inflammatory disease. All right. Now, this is just giving again more imagery to go with the things we just talked about. The infections can occur even in the absence of ejaculation, discharge of semen from the male genital tract. So that's really important to understand. Infections can occur when pregnant and can be transmitted to newborns. So what we do with that in mind is that every baby that is born, generally you can see sometimes they put that gooey stuff. That is an antibiotic to decrease the risk because it is such a devastating uh, illness to give to a child. So every baby born usually gets that bacterial gel in their eye. Screening, because chlamydia is so common, is recommended every year for women who are under 25 years old and women who are maybe over 25 but have additional risk factors. And some of those risk factors could just be having more than one sexual partner, not being in a monogamous relationship, being at risk because your partner has sex with other people. So there's many different things that could put you at risk. And those patients, usually we would continue screening beyond the cutoff of 25 years old. How do we treat chlamydia? So chlamydia can be successfully treated with oral antibiotics. Partner treatment is really important, and many programs encourage partner treatment. So if you're a patient and you are diagnosed with chlamydia, many times we'll give you medication to distribute to your partner, just because we want to cut back the risk of this getting to somebody else. Repeat infection with chlamydia is common, so repeat testing is recommended in about 3 months. Again, prevention is the best treatment using, a condom, some barrier protection, or abstaining. Let's talk about gonorrhea, and this is labeled the clap. And why do we call it the clap? It actually goes back to France, where at that time the brothels or the places where the prostitutes would gather, it was called clapier. And so that's why they figured more or less people who visited this place got this disease, and so they thought they'd label it the clap. This is usually, again, a silent infection, much like chlamydia. The symptoms may include burning when you're passing urine. You may have a lot of vaginal discharge. Uh, the color might be yellow or green. You may have, again, that vaginal bleeding that is just like, why am I bleeding? It's not my period. Pelvic inflammatory disease. You may also end up with chronic pelvic pain. So again, this is actually a better view than the last one I was showing for chlamydia. This is what the normal cervix should look like, and this is the inflamed cervix with discharge that is secondary to infection with the bacteria that causes gonorrhea. Now, we talked about pelvic inflammatory disease. Here, as the bacteria rises up, it causes inflammation here in the lining, but it also goes up and can spread into the fallopian tubes and can cause not only scarring and infection, but blockage in the future. So most women, again, no symptoms, and it's bacterially transmitted. Gonorrhea can infect the eyes, the throat, the rectum, and even joints. Permanent damage to the reproductive system can make it difficult to get pregnant later on, as we showed in that image where it causes scarring, again, much like chlamydia. Women with a history of gonorrhea may be at a higher risk of ectopic pregnancy. All right. So again, signs and symptoms we talked about before, but there could be pain in your lower abdomen. You may have pain with intercourse, vaginal discharge, or bleeding. Signs of gonorrheal infection. Now, pelvic inflammatory disease, again, it usually occurs when a sexually transmitted bacteria spreads from the vagina, down here, to the uterus, up in here, to the fallopian tubes, and it can even go to the ovaries, right? So this is what a normal, healthy reproductive system looks like, okay? And here is our reproductive system with pelvic inflammatory disease and abscess in these spots. Common symptoms, you may have pain, you may have pelvic pain, fever, and vaginal discharge, but not always. Now, what I just showed you in terms of, we're going to go right back real quick, this area here being infected with pus can then lead to this, which is the same. Look at this fallopian tube, how nice and thin. And look at this, how what we call distended it is because pus is in there. And you can have these tubal ovarian abscesses, a pocket of pus that forms during an infection of the fallopian tube and ovary. And this is usually caused by pelvic inflammatory disease and can be quite debilitating, requiring antibiotics long term, and may even require surgical intervention. Now, we talked about, I briefly mentioned it, that you can have gonorrhea, which can go to the joints. And, disseminated gonococcal infection is not only what you have when you have the pelvic inflammatory disease, right, where that bacteria goes through from the vagina all the way up, infects the uterus and the fallopian tubes and even the ovaries. But you can have it spreading also to the joints, usually larger joints, more common in women than in men, and it affects the large joints like the knees and the ankles, swollen, tender. The patient might have fever, but that's in a sexually active young woman. It's not just, arthritic pain. You have to make sure it's not secondary to gonorrhea. You can also see an evidence of eye infection with the gonorrhea. So that the bacteria that causes gonorrhea, it invades the bloodstream and it spreads to distant sites in the body. So it's really important because these are very silent for screening. That's going to be the biggest way to kind of decrease this infection being perpetrated from one person to the next. Let's talk about syphilis. Many times people think, oh, syphilis, that's old, that's gone. It's resurged, it's back, and it's bad, right? So infection is spread by sexual contact. Again, it starts as a painless sore, something like this, kind of shallow. Usually occurs on the genitals, can be in the rectum or mouth as well, and that's considered stage one when you have that sore. And that sore usually we call stage one. It's usually about 3 to 90 days, three days to pretty much 3 months after you've been exposed. The next step usually is stage two, which occurs about 4 to 10 weeks after your initial infection. So that's going to be a body rash. You could sort of see that kind of like rash all over the body. Then, stage three, and that may occur years later, is going to be it affects internal organs. So it can lead to damage in the brain, nerves, eyes, heart. And this again is untreated because most times undetected syphilitic infection. So again, screening becomes a big part of catching these early and being able to take care of them because it can be treated if caught early. So again, prevention is the best treatment. Use barrier protection, example, of condoms. This spreads from person to person by skin or mucous membrane. And when you think about mucous membrane, that's like what's in the vagina, as well as if you think about what's on the inside of your mouth. That's like thinking about mucous membrane. All right. And you have any contact with the sore, whether they be vaginal, anal, or oral sexual contact, any of these, that's how it spreads from person to person when you have contact. It can be treated with antibiotics if found in the early stage. Late stages may lead to irreversible damage. And this is what we saw in that whole Tuskegee study. That was what they went all the way to the end stages of syphilis while treatment was yet available. So that's what we had to talk about in terms of sexually transmitted infections, specifically the bacterial ones. Please subscribe to Period Stories. Thank you for listening.